How many liters of oxygen for sleep apnea? If you or someone you know is dealing with sleep apnea, you might be curious about the various treatment options available, including the use of supplemental oxygen. Let's break down the details to help you understand how oxygen therapy works and the specific amounts of oxygen that might be used. Sleep apnea, whether it's obstructive or central, involves disruptions in breathing during sleep, which can lead to low oxygen levels in the blood. One way to address this is through nocturnal supplemental oxygen, or NSO. In studies and clinical trials, the amount of oxygen used can vary. For instance, a well-designed study published in the American Journal of Respiratory and Critical Care Medicine used a relatively high flow rate of 5 liters per minute, L-min, of oxygen to see its effects on blood pressure in patients with moderate to severe obstructive sleep apnea, OSA. This particular study compared the effects of oxygen versus a sham oxygen, compressed air, control, and found that the oxygen completely eliminated the increase in morning blood pressure after CPAP withdrawal. This suggests that higher oxygen flow rates can be effective in controlling hypoxemia, which is the low oxygen level in the blood. Another key point is that the effectiveness of oxygen therapy can depend on several factors, including the severity of the sleep apnea and the patient's overall health. For example, in patients with central sleep apnea related to congestive heart failure, oxygen therapy has been shown to be effective in reducing the apnea episodes, although its long-term impact on mortality and cardiovascular outcomes is still being investigated. In summary, when it comes to the amount of oxygen used for sleep apnea, a common flow rate that has been studied and shown to be effective is around 5 liters per minute. However, the optimal dose and duration of nocturnal supplemental oxygen can vary and are subjects of ongoing research to clarify their effects on various clinical outcomes. Always consult with a healthcare professional to determine the best treatment plan for your specific condition.